The EarlySense system can be used in different modules according to a patient's medical needs. This video will demonstrate how to respond to an active alert at the bedside and CDS, as well as how to suspend the system. For additional information on how to operate the EarlySense system, please refer to the relevant user guide provided upon installation or online at earlysense.com. Since different patients have different medical conditions, each feature of the EarlySense system can be turned on or off or individualized at any given time per your facility's clinical policy. Reminder, you will need to unlock the CDS by hitting the lock in the top left-hand corner. Click on the patient's room and bed number on the CDS to access their profile. To toggle between on and off status, simply press the bell on any chosen section under the patient's profile. When the bell is green, the feature is on, and an alert or reminder will be generated. When the bell is gray, the feature is off, and no alert or reminder will be generated. When turning off an EarlySense feature, you will be asked to confirm your choice. When heart rate or respiratory rate alerts are turned off, it will be indicated on the CDS screen. Only when the bed exit alert is turned on, a bell symbol is indicated on the CDS screen. Only when the patient turn reminder is on, a counter will appear on the CDS screen. When a clinical alert is active, it will be indicated on the InSight via a red flashing light, on the CDS or remote view device, and on your mobile device. You can respond to an alert by pressing the front panel of the InSight device. If a patient's condition has not changed, for example, their heart rate is still above the threshold, a second alert is generated. In these cases, you can choose to suspend all active alerts by pressing the InSight twice. All alerts will be suspended for 15 minutes, allowing you time to assess your patient. If the alert is still active on the bedside, you will be receiving reminders on your mobile device every 5 minutes until the alert is acknowledged in the room. An alert sound can be muted on the CDS. To change the default heart rate and respiratory rate thresholds, select the threshold limit you want to adjust on the patient profile, and select the up-pointing arrow if you want to raise the thresholds, or the down-facing arrow if you want to lower the threshold limit. When you reach the desired threshold limit for the patient, simply touch the new threshold number or wait. If a threshold is different than the default value, the defined threshold will appear next to the relevant vital signs' current value on the CDS. Throughout the course of patient care, you may see gray vital signs values for heart rate or respiratory rate. Gray numbers indicate temporary signal instability. In such case, heart rate or respiratory rate are grayed out until proper signal is being detected and measurement is resumed. This helps prevent inaccurate readings. Using this unique mechanism, the system minimizes false readings and alarm fatigue. Potential causes for graying out are excessive talking, eating while in bed, longer duration of patient movement, irregular heart rate or respiratory rate, such as periodic breathing, arrhythmia, etc. For more information on the use of the EarlySense system, please visit www.earlysense.com.